So, yes, we do it. It's non-invasive treatment. It's well-tolerated treatment in general, but we'd have to see you and see your scans. And we really spend an hour or 2 hours with each patient going over all the details.
I see. And after the 5 treatments, is that it? I mean, is it...
Well, I mean, if you listen to the program, yeah, we treat the tumor. The success rate's 90% after the 5 treatments. We follow the patient, so we're not abandoning you. We're going to see you back and prove to you that most likely the treatment works. So you're going to have the document in your own hand. You will see with your own eyes exactly what happens. It's like a report card to you and to me that the treatment worked if we offer it to you and if you accept it. Obviously, treatment's like a marriage. Both parties, one has to offer it and one has to accept it. And then we give the treatment and then we report back to you so you'll know exactly what's going on.
Of the fatty lining of the stomach. There's 3 nodules.
Well, I'd be happy to see you.
I'm sorry?
I'd be happy to see you if you wish.
Yes, I'm considering coming in. I'm going right now. I just gave blood and I'm going for a biopsy on the coming week. So once all of that is over with, I think I'm going to come in and make an appointment and get all my scans and stuff. You need all of that, right?
Yeah, you can bring it in, or we can get it for you. So we're pretty good at that.
Get it for me. That's even better.
Yeah.
But I'll make an appointment after I get the biopsy report.
All right. God bless you and thank you, and I wish you well.
Thank you so much.
Okay. Bye-bye. Call us during the week, and we'll send you the booklet and DVD so you can learn more about us if you wish.
Okay. Thank you.
Thank you. Bye. God bless you. Bye-bye. This is Dr. Lederman from Radiosurgery New York. We're going to hear just from a couple voices, and we'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. Oh, I want to tell you, by the way, we have 5 unique shows every weekend. So we have this one on WABC every Saturday from 5 to 6 a.m. And then there's 4 shows on WOR. The first is at 1:30 a.m. to 2:30. Then we have another new show at 3 to 4 a.m. And there's another new show at 6 to 7 a.m. tomorrow on WOR, which is 710 radio. And then the last show of the weekend is Sunday night on WOR from 9 to 10 p.m. So if you like the show or want to listen, we have lots of doctors. I went to a wedding recently, and I saw my doctor friends, and many are listening to the show. So for doctors, we invite you, and it's a compliment that you're listening. We try to present cases, and we try to learn from cases, and present a lot of news articles of things you may not have otherwise seen in the newspaper, and bring attention to them that will help your life. We have lots of things to discuss this weekend, and it's clear we're only like a tiny bit through, so many more things we're going to be discussing on the WOR shows this weekend. And as I say, there's 4 of them tomorrow: 1:30 a.m. to 2:30, 3 to 4 a.m., 6 to 7 a.m., and then 9 to 10 p.m. on WOR. And we'll be back on WABC next week at 5 to 6 a.m. Saturday morning. We had a woman who came in, 76 years old, American woman whose family's from Germany, and she was diagnosed with breast cancer. She had mammogram and needle biopsy in the New York area, not in New York City, and she started hormonal therapy, and then she flew to Germany for a kind of treatment called photodynamic. I don't really believe it's photodynamic. The whole idea of photodynamic is you get a chemical injected and expose it to light. That's why it's called photo. The photo is the light, and the light is supposed to make the chemicals activate in the cancer. Well, she had it, and it didn't work. She had another PET scan in July 2013, in October 2013, and everything was worse. The lung was worse. The breast was worse. The cancer had presented as metastatic breast cancer. By the way, she wasn't getting mammograms, so it's a warning sign to all. Please get your mammograms. And if you're sitting there with a lump in the breast, please give us a call, and we will, if you wish, diagnose it, put a little needle in. It's painless, and get you staged up so you know what it is. There's no reason you should be home wondering or getting worse. It's not going to get better by itself if it's a cancer. So please don't die needlessly. So give us a call. So this woman had no mammograms. She had some treatment. She went for Germany, spent a lot of money, cash money in Germany for photodynamic therapy. It did not work. She then had chemotherapy. We have a caller. We're going to take this call just 1 minute. It's Dr. Lederman. You're on the radio.
Yes, good morning.
Good morning.
I was going to ask you about there are some medical nutritionists who are using alternative therapies to help the cancer patients to build up their immune system and avoid all the surgeries altogether. Do you do that type of thing, or find that?
Well, if you look at the data, and if I'll present the data on another show, and I have presented it in the past, but people who take alternative medicines, vitamins, antioxidants, herbs, have about a 10 to 20% higher death rate from cancer and from heart disease. Most people who are pushing this stuff are selling this stuff, and they're making lots of money, but there is no data showing benefit. And I see so many patients who are on herbs, who are on vitamins. I had one man to come in this week. He's on 18 different herbs, vitamins, antioxidants. He spends $500 a month thinking he's going to get better, and we worked him up. He's getting worse and worse. So there's just not the data for it. I know that many Americans are looking for a magic pill, and I wish I could find that magic pill. It doesn't exist.
Intravenous vitamin C?
Vitamin C. I just had a woman fly in from Texas on vitamin C drip and mistletoe with cervix cancer, a beautiful 44-year-old woman, and the cancer was growing on mistletoe and vitamin C drip, which is the usual. There's just not data for it, and I'd advise you to not waste your money, not spend your money. And again, the data shows an increased death rate from cancer and from heart disease in people who are taking these things. And it's because these things are not even medicines. These things are destroying and upsetting the body. We only have a few seconds left. I'm happy to speak to you later, or you can call during one of the other programs and we can talk more about it. So let's do that. We're just about at the end of the hour. This is Dr. Lederman from Radiosurgery New York. Thank you for calling. You can call us during the week for the booklet and DVD at 212-CHOICES. And if you have questions about medicines, please call if you want to come in, which is the best way. Give us a call and make an appointment. We promise to see you within one day. I think we're at the end of the hour. Is that right? Okay, so we're going to close up. This is Dr. Lederman. Have a great week. We'll speak tomorrow at 1:30 a.m. God bless you, and thank you for tuning in.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation and it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience